Welcome to the Nutrition for Common Side Effects of Cancer Treatment video series. My name is Anne, and I am a registered dietitian working in cancer care. Today, I'm talking about a common but often frustrating side effect of cancer treatment, diarrhea. I'll explain what it is, when to seek medical advice, and how you can manage it through diet, lifestyle, and medication support. What is diarrhea? Diarrhea means having loose, watery poop and going 4 or more times in a day. It is a common side effect of many cancer treatments like chemotherapy, radiation, or immunotherapy. It can also be caused by infections, certain medications, or the cancer itself. While diarrhea can be a normal part of treatment, there are times when it needs medical attention. Call your healthcare provider if you've had diarrhea for more than 2 days, especially if you're pooping 6 or more times a day. If you are taking anti-diarrheal medication as prescribed, but your diarrhea doesn't go away. There's blood in your poop, strong stomach cramps, or a fever of 100.5 degrees Fahrenheit or 38 degrees Celsius or higher. You feel dizzy, weak, or have trouble standing up. You're over 50 years old and suddenly have new or long-lasting diarrhea. You notice unexplained weight loss. Your sleep is interrupted because of frequent trips to the bathroom, or if diarrhea is getting in the way of your daily life. What should you eat and drink to help manage diarrhea? Managing diarrhea starts with what you eat and drink. Try eating 5 to 6 small meals or snacks every 2 to 3 hours instead of big meals. Drink 9 to 12 cups, about 2 to 3 liters of fluid each day, unless your doctor has told you something different. Good drink options include water, oral rehydration solutions like a homemade version, broth, milk, or fortified plant-based beverages made from soy, oats, or nuts, decaffeinated coffee or tea. Watch for signs of dehydration like dry mouth, dry skin, dark yellow urine or pee, not needing to pee as often, or feeling lightheaded or dizzy. If you think you may be dehydrated, try to drink more water or oral rehydration solution and monitor your symptoms. If they do not get better, contact your healthcare team. Choose foods with soluble fiber. There are 2 types of fiber, soluble and insoluble. Foods with fiber have different amounts of each. When you have diarrhea, the type of fiber you eat matters. Choosing foods with more soluble fiber can be helpful when you have diarrhea. Foods with soluble fiber can help to firm up loose poop. Try bananas, oatmeal, psyllium, peeled apples, and soft cooked vegetables. Foods higher in insoluble fiber can make diarrhea worse, so it's best to limit or avoid raw vegetables or salads, nuts and seeds, legumes like beans and lentils, whole grains. Until your diarrhea has fully gone away, keep eating foods higher in soluble fiber and lower in insoluble fiber. Which foods or drinks should you limit or avoid? Just like foods that have higher amounts of insoluble fiber in them, some other drinks and foods can make diarrhea worse. Monitor how your body feels after eating or drinking them. You only need to limit or avoid the food or drink that makes your diarrhea worse. Alcohol, caffeine like coffee, tea, energy drinks, or cola, Alcohol and caffeine can make you pee more, which puts you at risk of dehydration, especially when you are already losing fluid from diarrhea. Fried or greasy foods can be hard to digest when your gut is already moving too fast. Spicy foods, especially if you don't usually eat them. Some spices can irritate your stomach and intestines. Sugary drinks like pop and fruit juice, they can bring fluid into your gut and make diarrhea worse. Sugar alcohols like sorbitol and xylitol, usually found in sugar-free or diet-type foods. Dairy products, but only if you notice symptoms like gas, cramping, or loose poop 30 to 60 minutes after eating them. What about probiotics? Fermented foods like kefir, yogurt, and kimchi have probiotics in them and are good food choices. Probiotics may help restore balance in your gut. If you are interested in taking a probiotic capsule, especially after treatment like a bone marrow transplant, talk with your healthcare team first to learn if they are right for you. Taking care of your skin. Frequent diarrhea can lead to skin irritation. Try using a sitz bath often to gently cleanse the area. If you are getting radiation to your pelvis, ask your care team whether a barrier ointment is right for you. What if food changes aren't enough? Sometimes changing your food and drink habits isn't enough to stop diarrhea. Your healthcare provider might recommend or prescribe anti-diarrhea medication. Don't take over-the-counter diarrhea medications without checking with your healthcare provider first. If your diarrhea gets worse, especially if you're dehydrated, you may need to go to the hospital for IV fluids and nutrition. How long should you follow these tips? Follow these tips in this video until your diarrhea has fully gone away. Once your poop returns to normal, you can slowly start eating your usual foods again. If diarrhea doesn't go away, don't wait. Reach out to your healthcare team. Diarrhea can be uncomfortable and tiring, but you don't have to go through it alone. Talk to your healthcare team. Take care of your body and know that there are steps you can take to feel better. If you would like more support, ask your healthcare provider for a referral to a cancer care dietitian. For support with general nutrition questions, you can call HealthLink at 811 and speak with a dietitian. For handouts and resources, or to check out the other videos in this series, visit ahs.ca/nutrition handouts. Thanks for watching.